After they both leave, the system notifies him that the quest has been completed, and he's been awarded 2 level-up vouchers. Some time passed, and we see Sungwoo at Yongin University basketball court with some others, competing. Later, when he's being interviewed, he explains that at first he was in despair. He thought he was incomplete and worthless. That's what he believed. It's like the world had cast him aside and he just hated the world for it. As the cameraman focuses on Sungwoo, the interviewer states that despite all that, he is now a prospective member of the Yongin University wheelchair basketball team. Even appearing on newspaper, Sungwoo continues saying perhaps it was because he showed an impressive performance at the charity wheelchair basketball tournament hosted by Myeongsung Hospital. There were many people who supported him, and his mother was always there for him. This brought both the interviewer and the cameraman to tears. They hope that Sungwoo's endeavor and determination will undoubtedly bear fruit. She then asks if there's anything he'd like to say to his peers, which he thinks for a moment. Looking and seeing Lee Gi-juk among the crowd, he answered that there's a teacher who guided his immature self. He wants to convey this message to that person and to everyone else. With a bright smile, he say that miracles are always closer than you think. The scene then changes to Chief Lim assisting a patient, as he sits around his desk and lets out a loud sigh while looking at the patient's x-ray. I'm already swamped with work and now I have to handle radiology too? This is so frustrating, he grumbles. Someone knocks on the door and he tells them to come in. We see that it's Chief Park that's always trying to one-up Lee Gi-juk, holding a cold beverage. He asks Chief Lim, why is he who is in charge of personnel handling radiology work? As he takes the drink from Chief Park, he agrees and questions why is he even there? Even if he was a radiologist before, now he's the chief personnel, which Chief Park remarks that more radiologists should be hired. He then starts laughing and asks if it's that tough. Trying to do someone else's job must feel like dying. Chief Lim tells him to pipe down. He's trying to concentrate. He then notices something strange with the femoral head, or also known as the head of the femur that attaches to the pelvis. Suddenly he shouts in disbelief that it looks like there could possibly be a microfracture of the femoral head, telling Chief Park to check the chart and see who's the attending physician, which he's already doing. They then got surprised when they see that it's Dr. Mayung, reading the document. Chief Park is confused that it say according to the attending physician's assessment, there's no problem. Of all people, the attending physician turns out to be the prince of this place. Chief Lim sighs while saying that it's turning into a mess, which gave Chief Park an idea. Don't mention the tiny fracture to Dr. Mayung, he says, which makes Chief Lim ask why. He then explains that if Chief Lim bring it up unnecessarily and a fracture is found, he'll be the one taking the heat. And if there's nothing, he'll be the one getting an earful. This got Chief Lim thinking. It's not even Chief Lim's responsibility. The attending physician already diagnosed that there's no issue. Chief Park remarks that if it were him, he wouldn't say a word, which Chief Lim agrees that it makes sense. He'll follow Chief Park's advice. Chief Park then checks the rest of the patient's information before calling Ju to come to his office. After a while, Ju arrived at Chief Park's office. He asked Ju if he assigned the new patient who just came in. Ju tells him he hasn't assigned them yet. He was actually planning to do it later today. Chief Park then asked to see the chart. He sees that the patient is Kim Daegyu, a baseball player. Ju informs him that the patient decided to receive outpatient treatment at their hospital. He mentioned being recommended by a friend of the chief of the Rehabilitation Medicine Department, Chief Park, then confidently asked if he's the one going to treat him, which he's notified that chief of the Rehabilitation Medicine Department has a specific doctor in mind to take care of it. This surprised Chief Park. He asks who's the doctor, full of curiosity. To his dismay, he's informed that it was personally requested that they entrust him to assistant team leader Lee Gi-juk. Ju guess it would have been difficult to ask Chief Park for a personal favor. That's probably why Lee Gi-juk was chosen. Chief Park then gets disinterested and say who cares, telling Ju to proceed with that. Checking the next medical chart, he sees it's a patient named Moon Seon-gyu, a patient with hemiplegia due to a stroke. Smirking, he tells Ju to assign this patient to Lee Gi-juk, which surprises Ju. He tries to discourage Chief Park, saying Lee Gi-juk will have too many patients, which makes Chief Park go off on him. Do I have to worry about the assistant team leader's busy schedule too? You listen to what the rehabilitation medicine chief says, but not me? Whose department are you in? Ju can only apologize under the pressure, but Chief Park doesn't let up. He barks at him to assign as he's instructed, thinking that he's trying to carve out a position for senior resident. If Lee Gi-juk is left unchecked, he would even aspire to his position. He'll have to nip him in the bud before he grows any bigger. Lee Gi-jok meets Ju. Ju asks him if he knows a player named Kim Dae-gyu from the Happy Hawks, which he does. Ju tells him that he's a friend of the chief of the Rehabilitation Medicine Department. He specifically requested Lee Gi-jok to take care of this patient. This confuses Lee Gi-jok a lot. Opening his eyes wide, he shouts, "Pardon? That's how it is. What do you mean that's how it is?" Ju also informs him that it seems he'll have to take care of a patient who was admitted yesterday named Moon Seon-gyu. He questions Ju about the amount of patients under his care. It would be better if the chief or the manager took over. Ju explains that he tried to somehow stop it, but it seems like Chief Park is quite upset. Since he followed the orders from other department heads, Chief Park thinks his words won't be heeded, so he insists on assigning patients to Lee Gi-jok. Ju says that his situation is like a shrimp stuck in a fight between whales. But one of Lee Gi-jok's patients, Han Guk-young, is scheduled to be discharged this week. As Ju is talking, Lee Gi-jok is given a quest, turning crisis into opportunity. He can't believe he's getting a quest in this situation and it doesn't sound good. Ju tells him he'll check it out, so if Lee Gi-jok has a hard time, he should let him know, which he responds that he understands. The reward for the completion of the quest is an opportunity for promotion. This surprises him. He then looks into the patient named Kim Dae-gyu, a player from Happy Hawks. He used to be a star player, but nowadays he's playing in the second team, and his batting average has dropped below 200. If we're talking about a crisis, it would probably be him. The more information we have about the patient, the better, so he should look for more. On the other hand, patient Moon Seon-gyu has had a long onset, but his condition isn't severe. He then notices on the report chart that it says, light pain in the pelvis, which confuses him. Patient Moon Seon-gyu then comes in and they introduce themselves to each other. He directs Moon Seon-gyu where to go. As he's doing so, Moon Seon-gyu grunts in pain, making him ask if he's okay, which he's reassured that it's nothing serious, since he's just been admitted. A brief assessment will be conducted today. He then questioned Moon Seon-gyu about the mild pelvic pain mentioned in the chart. Moon Seon-gyu confirms that he feels pain in his pelvis when he put weight on it, so he's been avoiding actions that put pressure there. Lee Gi-jok asks him if he's had an X-ray, which he tells him yes. He had it done as soon as he arrived, but they said there was nothing unusual, really. Well, that's a relief at least. Let's take a look. Could you please lie down here? Lee Gi-jok instructs him. He complies and tries to get up out of his wheelchair, shaking. Lee Gi-jok gives him a hand. He warns him that he's going to move his leg a little. As he does so, Moon Seon-gyu complains about the pain. Lee Gi-jok tells him he'll have to lower his clothes a bit, which he remarks that it's fine. He's used to getting shots in the butt anyway. Using his skill, Lee Gi-jok checks and sees a strange spot. He informs Moon Seon-gyu that there's some swelling in his pelvis, asking if it hurts, which is confirmed to hurt a bit. Lee Gi-jok is confused on what it could be. No matter what he thinks of, it doesn't add up. He then tells Moon Seon-gyu that based on his observation, he suspects a minor fracture, so it would be best to carry out another X-ray. A confused Moon Seon-gyu says that he had an X-ray the day before he was discharged from the other hospital. And even here at this hospital, the attending doctor also said there were no problems. Lee Gi-jok tells him it wouldn't hurt to confirm, so he should bear with them for just one more test. He tiredly agrees before wheeling away. Lee Gi-jok then runs into Chief Park, and the first thing he asks is if there's a problem, which Lee Gi-jok tells him that he suspects a fracture in Moon Seon-gyu, which he's shocked, shouting, "What did you say?" Wondering to himself, how did he figure that out? It's concerning. He then starts accusing Lee Gi-jok of causing the fracture because he didn't see one when he checked the chart. This caught Lee Gi-jok off guard. Lee Gi-jok shouts in disbelief that he's suspecting him of causing it. All he did was slightly lift and then lower the leg. Chief Park turns away from him, saying the attending physician clearly stated there were no issues before the patient came here. Lee Gi-jok say he gets that, but it's not true. He also didn't make any harsh movements. Chief Park say that accidents often occur without warning. They should conduct a re-examination. For now, it might not be a fracture. The attending physician said it wasn't a fracture, and now there might be one. And you said you didn't do anything? Lee Gi-jok can only wonder to himself what's happening. Remembering back on the quest, he realized that the crisis mentioned by the quest was not player Kim Dae-gyu, but Moon Seon-gyu. The scene then changes to a phone ringing. Ma-young answers while introducing himself and his position. The person on the other end asks him if he's busy, which he says he's not. And what can he do for them? We see that the one that called him is head of Rehabilitation Medicine Department, Kim Jun-myung. asking if he has a patient named Moon Seong-yu, which he confirms. He's then told that they just received a request from the Rehabilitation Therapy Department saying they suspect a minor fracture in the femoral head. This annoys him. He asks who's the attending therapist, but they're not sure who is. They're just forwarding the message, saying there could be a mistake in the interpreting of the X-ray image. Really annoyed now, he say he still has the image, he'll check it again, and get back to them, bringing up the image, then hanging up the phone, saying that the Rehabilitation Therapy Department should just listen and do as the Rehabilitation Medicine Department orders without talking back, just because they've grouped the therapists together and called it Rehabilitation Therapy Department. They think they're special. Looking at the image, he sees the fracture they were talking about. We then see Chief Lim stretching while complaining that they need more radiographers. Suddenly Myung bursts in shouting, "If there's any radiographer here," surprising Chief Lim and making him fall over. Myung asks what he's doing here, while he asks back Myung what brings him to the radiology department. As he gets up and clears his throat to hide his embarrassment, he explains that the regular person is on a leave, so he's filling in, complaining that there are so many x-rays today, it's impossible to handle them all alone. Myung thinks to himself that if rumors spread about his mistake, it would be embarrassing. He then tells Chief Lim that he came because of Moon Seong-yu's x-ray. Chief Lim asks him if he also suspected a minor fracture. Myung twists his face, trying to look menacing while asking if he thinks his diagnosis was wrong. This makes Chief Lim stutters while saying that's not what he meant. Myung explains that someone from the Rehabilitation Therapy Department called and said that he failed to detect a minor fracture, which is absurd. Do they think they're doctors? Why do they care so much? Shouting at Chief Lim if what he's saying is right. Chief Lim can only agree with him. Slamming his hand on the table, he tells Chief Lim that he has to help him out. Chief Lim can only reluctantly ask how can he assist, throwing up his hands and saying it's nothing difficult. He just has to delete the X-ray image of Moon Seong-yu. Chief Lim protests, saying his position will be in danger. Myung came up with a solution immediately. He can just delete the image where the minor fracture is visible. They took the picture, but they couldn't confirm a minor fracture. It's perfect. Chief Lim thinks to himself that he has to rely solely on his father's reputation. Such an inexperienced guy, saying he understands. He will make it appear as though they missed taking the images despite having the order. The scene then changes to Ju telling Lee Gi-jok that it has become a dilemma. Lee Gi-jok asks what he means. He explains that he checked patient Moon Seong-yu a while ago, and it turns out he does have a minor fracture in his femoral head, and he rechecked the x-ray they took before, and there's nothing abnormal in the image. Lee Gi-jok shouts. If he's sure there really were no abnormalities, he swears he didn't do anything. Ju also finds it strange, so he tried checking it, but it seemed things got messy. Myung has ordered the x-ray, but it seems Chief Lim overlooked it in his busyness. Since they don't have an image of the minor fracture, they cannot be sure who is responsible. If they had that image, they could have clearly been able to pinpoint who is the one who's responsible. This gets Lee Gi-jok thinking about finding the image. For now they're asking Lee Gi-jok and Chief Lim to write an explanation. But he shouldn't worry too much because it's probably nothing. As Ju is walking out, he say that no matter how much they need someone to take responsibility, they're going too far. Lee Gi-jok knows that it may only be an explanation, but the moment he writes it, it's his responsibility. He didn't cause the fracture in Moon Seong-yu. That's for sure, but because he can't prove it, they want him to take the blame. He can't let that slide. We then see everyone gathered up together. Chief Park barks asking, how is the atmosphere in the therapy room so tense these days? What if a medical accident happens? Ju tries to tell him that this won't lead to a medical accident. Chief Park shouts, saying if it's not a medical accident, then who's going to be accountable for the patient's fracture? He then turns to Lee Gi-jok, asking how is he going to solve this, asking if he's written the incident report. Lee Gi-jok firmly tells him he hasn't and he won't either. Fuming, Chief Park asks him what did he just say.